Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et le Premier ministre, l'Honorable Blaine Higgs. Dr. Russell.
Good afternoon, everyone. Bon après-midi. Before I start with my official remarks, I just wanted to give a shout out to Ambulance New Brunswick, to our paramedics. This week is Paramedic Services Week, and I just wanted to thank each and every one of you for the incredible job that you're doing every day, and especially during this pandemic. We rely very, very heavily on the teams around the province to deliver excellent service in very stressful, difficult times on a good day. So on a bad day, like during a pandemic, it's even more important to express our appreciation. So thank you. Un gros merci. So, many times over the last 3 months, I have told many people, including you all, that we are in this together. This week, we are discovering the true meaning of that phase. In coping with the COVID-19 pandemic, we have all had to rely on one another. We have all had to put our trust in one another. Je vous ai répété à maintes reprises au cours des 3 derniers mois que nous sommes tous confrontés à la même situation et que nous devons tous travailler ensemble. Cette semaine, nous constatons à quel point c'est vrai. Pour traverser la pandémie de la COVID-19, nous devons compter les uns sur les autres. Nous devons tous nous faire confiance l'un dans les autres. We have all had to take ownership of our actions and work together to slow the spread of this disease. And this has never been someone else's problem. Every New Brunswicker in every corner of our province has a role to play. There is now a cluster in Zone 5, which is the Campbellton-Dalhousie area. And some may regard this as an issue that does not concern them because they don't live there or haven't visited there lately. But I need to tell you that in the strongest possible terms, this is not the case. Chaque citoyen du Nouveau-Brunswick, dans tous les coins de la province, a un rôle à jouer. Il y a présentement une éclosion dans la zone 5, soit la région de Campbellton-Dalhousie. Certains peuvent croire que cette situation ne les concerne pas parce qu'ils ne demeurent pas dans cette région et ne s'y sont pas rendus récemment. J'ai le devoir de vous dire avec le plus d'insistance possible que ce n'est pas le cas. I need to tell you that we know, based on our contact tracing of the current cases in Zone 5, that people living outside that region are in the circle of transmission. And this cluster could easily spread to other regions of New Brunswick if we fail to work together. And this is why every New Brunswicker must be vigilant. And I think in past times, we've always had advice about what to do in a fire, stop, drop, and roll. Well, I've been telling you for 2.5, almost 3 months now, what to do in a pandemic. Physically distance by 6 feet, wear your mask, wash your hands, cough into your sleeve, wipe down surfaces. These are the things that you need to do right now still as you wait to get tested. I know the wait times have been long on 811, but all the people who need to get tested are getting tested. That's going to happen over the course of the next several days. So again, be patient and do what you can do in the meantime, all the things that I just mentioned. Watch for symptoms, and everyone must keep to themselves and keep their families safe. So again, not having many people over to your house, and if they are at your house, then please make sure they're inside your bubble and make sure that you socially distance when they're there and stay 6 feet apart. Today, there are 2 new cases of COVID-19 to report. And again, these new cases are in Zone 5, and they're all related to the travel case. And by the way, that investigation is still ongoing, and I know information has been shared in different media. And again, I think we have to be patient while the investigation is still unfolding around all of those details. So And again, while we're in a pandemic situation and there are cases outside of our province, we do have to remain vigilant, and we do need to be aware that we can have cases at any time during this pandemic until there's a vaccine. There are now 8 active cases in the province, all located in this region, and in addition, 2 of the previously confirmed cases are now in hospital under intensive care, but I have been told that they are stable at the moment. And I think we should really keep them in our thoughts right now. The new cases are as follows: an individual aged 30 to 39, and this is unfortunately a healthcare worker who works in a long-term care facility, and the actions that public health is taking right now is to rapidly test that particular facility. An individual aged 60 to 69. J'annonce qu'il y a 2 nouveaux cas de COVID-19 à signaler au Nouveau-Brunswick aujourd'hui. À nouveau, ces nouveaux cas se trouvent dans la zone 5. Il y a présentement 8 cas actifs dans la province, tout dans cette région. De plus, 2 des cas que nous avons confirmés auparavant sont présentement hospitalisés aux soins intensifs. Les nouveaux cas sont répartis comme suit. Une personne âgée entre 30 et 39 ans, et c'est un travailleur de santé qui travaille dans un foyer de soins. Une personne âgée entre 60 et 69 ans. Alors, celui qui travaille dans un foyer de soins, on fait des tests rapidement aujourd'hui pour faire tester toute la population à ce foyer de soins. Our public health team and our partners in Zone 5 are working hard to trace those who have been in contact with the confirmed cases. It is vital that if you are contacted, you must be truthful with public health and you must follow their directions to the letter. We really rely on you. We really depend on the public when we are doing these contact tracing, in these contact tracing situations. It is very, very important that everybody is forthcoming and cooperates, because that's how we can keep everybody safe. We are expanding testing in this region with priority given to those showing the common symptoms of COVID-19. And around people staying safe and being forthcoming with information, I think it also is important that people's privacy is protected. We don't want to stigmatize people. We don't want to ostracize or villainize people who are tested positive with COVID-19 at this point in time. We want everybody to feel comfortable that they're going to get the support that they need, they're going to get the care that they need. So we really need to be compassionate at this point in time. If you are advised to self-isolate, do so immediately. Don't make a last run to the grocery store. Please ask a friend or neighbor to do it for you. So please look after each other, reach out and find out if people that you know that are in need can use your help and extend those offers. If you can, isolate yourself from the rest of your household and avoid sharing a bathroom or eating area. I know this can be challenging, but I can assure you that this will help protect people and save lives. If you have been in contact in the past 2 weeks with someone who lives in Zone 5, please monitor yourself and your family for symptoms of COVID-19. And if you do get symptoms, please call 811 and arrange for testing where you live. Do not travel to Zone 5 for testing unless advised to do so, and please remember that non-essential travel to this area should be avoided for the time being. And I was speaking with some of the medical officers of health from the region today, and they are really asking the public that they just minimize their travel and movement as much as possible. Again, we would just really like to get the situation contained and under control as best as we can at this time, and those are the type of actions that will help us be able to do that. Si vous avez été en contact avec une personne qui demeure dans la zone 5 au cours des dernières 2 semaines, veuillez vous surveiller et surveiller les membres de votre famille pour l'apparition de symptômes de la COVID-19. Dès l'apparition des symptômes, communiquez avec Télésoin 811 et prenez des dispositions pour subir un test dans la région où vous habitez. Ne vous rendez pas à la zone 5 pour y subir un test de dépistage, à moins que vous avez reçu une indication de le faire. N'oubliez pas qu'il faut présentement éviter tout voyage non essentiel dans cette région. Et ça, c'est quelque chose qui a été demandé par les médecins hygiénistes régionaux. Ils m'ont demandé, est-ce que vous pouvez vraiment demander aux citoyens de ne pas voyager si ce n'est pas nécessaire, parce que ça va nous aider avec les recherches qu'on fait maintenant, et ça va nous aider à protéger les gens autour de la province. Our public health team is doing all it can to slow the spread of the virus, but what happens next depends on each and every one of you. While some restrictions have been relaxed outside of Zone 5, the state of emergency remains in effect, and everyone must still take precautions to slow the spread of COVID-19. And I did receive many, many emails from folks who are affiliated with different gyms and whatnot, and are disappointed that we weren't moving forward with the second part of the yellow phase. And I have to say that, you know, this emerging situation in Zone 5, we don't have all the information that we need right now to know the extent of the spread of the virus at this time. And until we have that information over the course of the next week, we really did need to protect others at this time, and that's why we had to delay that onset. So I can understand and appreciate the frustration of businesses who were expecting to be able to open, and other organizations who were expecting to have certain activities take place in the next week. But we do ask for your patience right now. This is a really big investigation that we're conducting. There are many contacts to trace, and as I said before, some of those contacts are outside of Zone 5. So it really would not make sense at this point in time to put others at risk right now when we know that there's more contact tracing to be done and there are more cases that we expect to find. So please limit your close contacts with others, and please practice physical distancing whenever you can. And when that's not possible, wear your community face mask that covers your face and nose, and you know, keep doing all the things that we as a province have been doing. We've done so well, and obviously this has been noticed across the country. But the other thing the country is noticing as well is that we are in a challenging situation right now. So that is being recognized. This is a challenging situation, and it does mean that we have to pull together even more so than we have. And it means that whatever support we need to reach out and get that support. And so there is support available for frontline workers in particular. The Canadian Psychological Association is offering pro bono free services for frontline healthcare workers. So please tap into that resource. I'm not sure if I have the website here, but it is on our website, that information. So this is an unfortunate chain of circumstances. We have a cluster in Zone 5. We don't know the extent at this point in time. It could have happened in any part of New Brunswick, and any one of us could have been affected immediately at this time. So I think that's the other thing about if you live in another part of the province. This is, you know, we're in this pandemic for a very long time. So at some point in time, you could be touched directly by this situation. So the virus will find a way to spread if we let it. And I was thinking about, and my goodness, I'm rambling, sorry, but I've just had all these thoughts in my mind this morning. I was thinking about when you went to a birthday party when you're younger, there's a little game called freeze dance. And when the music stops, you all freeze. So if we all froze, we would stop COVID-19, but we can't all freeze, because we have to be able to have society and our economy function in some capacity. So our challenge has been from the beginning, how can we have society function? How can we have interactions and businesses function while keeping the risk of COVID-19 as low as possible? So that has been our challenge from the beginning, and we have always said that we were up for that challenge and we were willing to work really hard to allow that to happen. So yeah, we can't all freeze right now, but as much as possible, those people in Zone 5 should really take care and keep to themselves as much as possible right now while this investigation is underway. Je comprends que cette situation est difficile pour les gens de la région de Campbellton, d'Alousie. Tout le monde ressent l'anxiété et du stress. Si vous avez des amis et ou des membres de la famille qui demeurent dans cette région, je vous demande de communiquer avec eux. Faites-leur savoir qu'ils ne sont pas seuls. Faites-leur savoir que vous vous faites du souci pour eux et suppliez-les de bien se protéger. Rappelez-leur que nous sommes tous confrontés à la même situation et que nous devons nous tous travailler ensemble. The Zone 5 cluster has been stressful for healthcare workers, and as I mentioned before, there is some support available for them. And the fact that there's transmission in the healthcare settings in that region, again, my heart goes out to everybody who's being impacted by this right now, but obviously a healthcare worker whose job it is to go to the hospital every day or a nursing home, etc. I can tell you that I believe that anxiety would be very significant, and again, we have to have compassion and understanding to support all of the people involved right now. So I do want all the doctors and nurses and paramedics and other hardworking healthcare providers and essential workers to know how much we admire their dedication and hard work at this time. And when that stress becomes overwhelming, please do seek help. No one is alone in this. So we really need to support one another to get through this crisis, and we cannot afford to think otherwise. We truly are all in this together. Thank you. Merci.
Good afternoon. Bonjour. This has been a tough week for many New Brunswickers, especially those in Zone 5, the Campbellton region. As Dr. Russell said, we have 2 new active cases today, bringing the number of active cases to 8. One of the cases is an employee at a long-term special care facility. I want to ensure workers and residents and their families that we are taking this very, very seriously. Public Health has a rapid response team on the site at the facility. We are using rapid test kits that give a response within 45 minutes. We want to test every resident and employee of that facility. As well, we are encouraging people from the community to get tested. It is important, however, that you call 811 and book an appointment to be tested at the Campbellton Memorial Regional Civic Center or at the Inch Aaron Arena in Dalhousie. This week has been an important reminder of why we must remain vigilant and obey the directives of public health. Une mauvaise décision, celle n'est pas s'auto-isoler pendant 14 jours après être de retour au Nouveau-Brunswick. Tel que c'est exigé a des répercussions. Cela a des répercussions sur les personnes qui ont pris cette mauvaise décision, mais aussi sur les nombreuses personnes avec qui elle a été en contact chaque jour, et sur la communauté et sa personne vivre et travailler. I know you have questions about what occurred and how it is being dealt with. As I said yesterday, this has been referred to the RCMP, and any professional ramifications will be handled by the employer. I would encourage everyone to let the authorities deal with this. I know people are upset, but we don't want anyone taking matters into their own hands. Vitality has confirmed that the healthcare professional involved has been suspended. This situation is best left to the proper authorities. I trust that they will take whatever steps are appropriate. We knew that we would eventually have new active cases of this virus in New Brunswick. I don't want anyone to fear coming forward if they have symptoms, and they think they might have COVID-19. In fact, just the opposite. They should be honest and they should get tested. Getting the virus is not your fault. By getting tested, by self-isolating and taking the proper precautions, you are actively taking steps to protect your loved ones and your fellow New Brunswickers, in addition to yourself. This week has reminded us that the virus is still out there and that, given the opportunity, it can indeed spread quickly. Quand nous n'avions aucun cas, il était facile d'être complaisant et de penser que nous avions éradiqué le virus. Mais nous n'avions qu'à regarder les provisions voisines ainsi que nos voisins du Sud pour savoir qui ce n'est pas vrai. Quebec, Nova Scotia, and Maine all have active cases. While we have done a good job of limiting the spread of COVID-19 in our province, the reality is the fight is far from over. Our goal has always been to minimize our risk and to contain the spread of COVID-19 so that our healthcare system and our dedicated frontline workers are able to handle any active cases of the virus and not get overwhelmed. That is still our goal. I understand that returning to Orange is frustrating for those who live in the Zone 5 area, the Campbellton region in the north. You are still able to connect with another household, to get outside, to go to retail establishments, to eat at restaurants. But we needed to scale back to keep people safe. C'est pourquoi nous ne pouvons pas progresser vers la prochaine étape de la phase jaune dans le reste de la province. La santé et la sécurité des gens de Nouveau-Brunswick doivent passer en premier. We cannot move forward until we have a clearer picture of transmission. There's a good chance this virus could have spread outside of the boundaries of Zone 5. We need to know that conclusively, and we need to get a handle on the situation as quickly as possible. It was not that long ago that we had an active case of this virus in every part of the province. That could easily happen again if we do not remain vigilant. I can't help thinking of my own mother and how I would feel if she were at risk. She is one of the reasons I am working hard to keep New Brunswickers healthy and safe. Just like all of you, I too worry about my family and friends. When I say we are all in this together, those are not just words. Nous devrons continuer à travailler ensemble, à se soutenir les uns les autres et à répandre de gentillesse et la compassion. Together we can and we will get our province back on track. Thank you. Merci.
Thank you, Premier. Thank you, Dr. Russell. Merci, Monsieur le Premier ministre et Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Chaque journaliste aura une question. We will now proceed with questions from the media. Each reporter will have one question, and you have the right to pose your question in the language of your choice. David Coach, Times and Transcript.
Hi, Premier Higgs. It has been 1 week now since the province announced the reversal of the ban on temporary foreign workers in New Brunswick, and the reversal comes into effect today. I spoke to lobster industry officials who said the ban was a disaster for the industry. The reversal came too late, and the spring lobster season will be almost over by the time workers get here and have completed mandatory quarantine. Do you regret the decision to ban temporary foreign workers?
Absolutely not. When we looked at doing whatever we could to minimize risk in this province, that's exactly what we did. And I certainly feel very good about the progress that we collectively made together. I know that shutting down the province in many ways was a hardship for many businesses. But at this point, you know, those industries, along with others, are able to get up and running. And I think we all had to look at ways of doing that. I would have liked to have seen, you know, more people being available to help those industries. But I also would like to understand in real terms the impact that has resulted. I've spoken to some of the industries. I know that the market is soft because the supply is high and the market conditions for sales are low. So that aspect of referencing of the condition it's in likely applies greatly to the state of the market.
Thank you, Premier. Thank you, Mr. Coach. Matthew Wacomo, l'Acadie Nouvelle. Mathieu?
Oui, bonjour, pardon.
Okay.
Ma question est pour Dr. Russell. Vous annoncez aujourd'hui seulement 2 nouveaux cas et les 2 cas sont dans la zone 5. Est-ce que ça pourrait vouloir dire que la situation, au final, n'est pas aussi grave que ce à quoi on s'attendait hier et avant-hier, ou est-ce que c'est seulement une question de traçage de contacts et de tests qui a été effectué, donc il est beaucoup trop tôt pour faire une analyse comme ça que je viens de faire?
Vous avez raison, Mathieu Roacamo. C'est trop tôt à dire. J'aurais aimé pour vous dire que ça serait pas aussi grave qu'on croit, mais il faut vraiment attendre ces 14 jours pour vraiment déterminer combien de cas qu'on va voir à ce moment-ci. Il y a plusieurs gens qu'on a encore besoin de faire tester. Il y a encore même chaque nouveau cas, il va falloir chercher pour les contacts étroits. Alors ça va continuer pendant une couple de semaines à ce moment-ci pour vraiment déterminer combien de cas qui vont qui vont être le résultat de les premiers cas qu'on a vus.
Merci, M. Como. Merci, Dr. Michel Corriveau, Radio-Canada.
Merci, Bruce. C'est une question pour Dr. Russell. Alors, Dr. Russell, j'aimerais que vous nous expliquiez qu'est-ce qui a été fait jusqu'ici depuis que vous avez découvert un cas d'un travailleur de la santé dans un foyer de soins? Qu'est-ce qui a été fait? Qu'est-ce qui est en train d'être fait? Et qu'est-ce qui va être fait?
Alors, la planification pour chaque foyer de soins dans la province a commencé des mois, des semaines et des mois passés. Alors, dans la planification, si on découvre qu'il y aura soit un patient ou soit un travailleur de santé dans le foyer de soins qui testerait positif, le plan, c'est d'aller et tester tout le monde. Et en même temps qu'on fait tout le dépistage, le plan, c'est de isoler chaque patient dans le foyer de soins. Alors ça, c'est des plans qu'on avait commencé des semaines à passer. On a vraiment aussi fait comme un trial run. Il y avait un foyer de soins on a testé notre capacité de faire ça. Alors ça, c'est vite fait. Les gens qu'on a eu besoin de voyager à l'endroit pour les faire tester, c'est tout en place aujourd'hui. Alors, c'est presque tout fini. Alors, pour le foyer de soins, on avait un plan pour tous les foyers de soins dans la province. Et alors, aujourd'hui, c'est ça, on a découvert le test positif hier, je crois que c'était hier soir. Et aujourd'hui, c'est presque tout fini pour le foyer de soins au niveau des tests, des dépistages puis des testings et aussi pour isoler chaque patient.
Merci, M. Corriveau. Merci, Dr. Russell. Holly Mackenzie-Sutter, Canadian Press.
Hello, question for Dr. Russell. Can you confirm the individual suspected to be patient zero, their job title, specifically if they are a doctor or a nurse?
Well, as I said earlier, this investigation is far from over. So in terms of all the details that we have, the important thing to know is that we have the dates and times of people either having symptoms or testing positive, and we're tracing the contacts and getting all those contacts tested. And again, the other thing that we have done is to make sure that that area of the province is at a reduced phase. We went back to phase orange. So in terms of the total number of cases at this point in time and their job titles, I can just say that there are 3 healthcare workers who have tested positive at this time.
Thank you, Ms. Mackenzie-Sutter. Andrew Waugh, Telegraph Journal.
Hi, my question is for Dr. Russell. Dr. Russell, you talked about the testing threshold for New Brunswick and how you needed to have 2,300 to 2,500 tests a week in order to maintain confidence in the data and move on in the phases. But government data shows that that isn't being hit every week, and it isn't being hit on an average over the 10 weeks since testing began. So I'd like you to talk about that and how you have confidence in the testing data.
A couple of things. So we have always continued to expand the list of symptoms so that people would have a bare minimum of symptoms necessary to meet the criteria to get tested. We try to push out the messaging around testing to the entire province. We have capacity, we have supplies, we have human resources that can do all of this. And so in our plan, we knew that if there was a decrease in number of cases and there was a decrease in number of people who showed symptoms and then got tested, then the next phase of that approach was to adopt some asymptomatic testing to boost those numbers. And so we have done pre-op testing for a couple of weeks now. And so anybody who is going in for surgery would be tested. And now we're doing transport truck driver testing. So that started this week, and we're very pleased with that because this is voluntary testing. So we're happy about that. And so the fact that the numbers dipped a little bit low for a bit, again, we've had a plan to address that the entire time. And what's important right now is that in this situation in Zone 5, we have. In fact, from the beginning, Zone 5 has been the zone in the province that has had the highest number of tests per capita since this started. So the good news is that right now in Zone 5, they've always been tested at a higher level than the rest of the province. And in this particular situation, we are mobilizing testing. In fact, They have set up testing centers to test all weekend in that area, and it's at the Campbellton Memorial Regional Civic Center and the Inch Aaron Arena in Dalhousie. So the good news in this very unfortunate and challenging situation is that we have the ability to ramp up testing in a region on very, very short notice. So we have the 811 referrals. We have a couple of different ways to refer people right now. And there's been a total number of 200 tests since the new case was identified. And so overnight they're processing these tests. And so, you know, we can only do what we can do. And at this point in time, I feel that the efforts that have been put in place to increase the testing for this particular event has been significant, and I'm pleased with how the New Brunswick Health Emergency Operations team has been working and the public health teams on the ground.
Thank you, Mr. Waugh. Thank you, Dr. Tim Rosell, Global.
Hi there. My question is for Dr. Russell. Dr. Russell, could you talk about the challenges associated with contact tracing, especially since 3 of these 8 cases that are active in the province now involve healthcare workers? I know the initial number a day or 2 ago was in the 150 range, but it's obviously a lot higher than that now. Can you talk about the challenges associated with contact tracing in this context?
Well, the challenge is the number in terms of the number and the volume. The good news is we do have people that can do all that work and are doing that work. I think of the 81 contacts from one of the cases that we were able to do within 24 hours. We were able to trace all those contacts right away. We have the phone numbers and names of all the people that the healthcare workers had been involved with, so that's very helpful in terms of tracking people down. So obviously the large number is an issue that we're able to mitigate with the increased number of staff that can help out, and the fact that we have, because we've brought in resources from all around the province to help out, and also the fact that because these healthcare workers, we have lists of people they would have come into contact with, so that's helpful as well.
Thank you, Doctor. Thank you, Mr. Rosell. Vicki Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, do either of the health authorities, Voluntary or Horizon, bring doctors into New Brunswick from other provinces to work as locums who are not required to self-isolate for 14 days before they see patients? We've heard some community concern that this is happening.
So the regional health authorities make decisions at their level around what staffing needs they have. And WorkSafe New Brunswick has worked with different organizations around work isolation if necessary. So these are things that are considered when staffing issues are involved, but each RHA has the it's under their responsibility to have policies around the locums for work isolation.
Thank you, Ms. Hogarth. Thank you, Dr. Isabelle Larose, Radio-Canada. Elizabeth Fraser, CBC.
Hi there, my question is for the Premier. We've heard at these briefings that officials follow up on residents crossing the border into New Brunswick to make sure that they are self-isolating. What follow-up was done with the healthcare worker who crossed the border from Quebec, and how was the follow-up done, and how often?
Well, I think in this case, it's under investigation now to determine, you know, the information that was supplied at the border, and then what was supplied, what was told. That's part of the investigation in this particular case. But I think your initial synopsis of what we do in the situation is we meet each one coming. We understand where they're going, why they're going. Is it an essential requirement? Is it not? Is it a requirement for isolation? And then we do track that. But in this case, it's being confirmed just if the rules were followed, or if not, and that'll be determined in the coming days. But until that time, the situation has been dealt with, and we're now in the process of identifying the impacted personnel or individuals.
Thank you, Ms. Fraser.
Do you know
Ross
how
Lord, Global TV.
are done?
What's that? What was the question? How the follow-ups are done? Called. They would be called because they give all the information and contact information to our compliance officers, and then it depends on the situation. I would guess if it's a new situation, and then they would be called and checked on. If it's a situation where it is a routine, maybe there's been a rapport that's been developed there, so you know where they're going, and that's been followed up in the past, and you have some reliability in that factor. But many calls are made to verify the facts.
Thank you, Ms. Fraser. Ross Lord, Global TV.
Hello. I'd like to ask what is your current estimate for how many people this doctor has had contact with since his return to New Brunswick? I'm also wondering about whether the doctor was symptomatic or not when he returned to New Brunswick.
I can tell you that there are 3 healthcare workers that have tested positive at this time, and so the contact tracing for each of the healthcare workers is underway. And obviously, we don't have the total number of all of the healthcare workers at this time, but I know we did speak yesterday about a number of around 150, but that was including probably the first 3 cases that we had found. So as we find new cases, the contact tracing has to be done for each of them, and so we expect that number to continue to grow.
Thank you, Mr. Lord. Adam Harris, Telegraph Journal.
Thanks, Bruce. A question for the Premier. Premier, the federal government is considering easing restrictions at the U.S. border to allow for family reunification. I'm told it was broached during last night's meeting with the premiers and Justin Trudeau. I wanted your thoughts on which side of that issue you come down on.
So yes, it was discussed last night. I did have some significant reservations on how that might work, because my original thought was this was all going to take place like no earlier than June 23rd. However, I'm very pleased to report I had a call from the Deputy Prime Minister Freeland just a few hours ago on this very topic, following up on my concerns and how the process might work, and that it wasn't a general opening. It was trying to address the interrelationships that we have on both sides of the border and what that might look like in the coming weeks. It was something that the Prime Minister wanted to have clarity what the situations were in each province and how they felt. That's why he brought it up. But having Deputy Prime Minister Freeland call me was very reassuring about how the process would be developed, more in the line like maybe an application process, so all the facts are on the table, where they were going, and the fact that it isn't a visit. It isn't something I'm dropping across the border and spending a day or a couple hours on the Canadian side or on the New Brunswick side. It's actually a visit that would be at least 2 weeks in an isolated setting, so that our quarantine provisions could readily be followed. So that was reassuring, and we agreed that the protocols would be developed collectively, and so I think we can move in discussing this further.
Thank you, Premier. Thank you, Mr. Harris. Geneviève Normand, Radio-Canada.
Oui, ma question, c'est pour la Dr. Russell. On vous a posé la question en anglais tout à l'heure, mais j'aimerais que vous nous disiez dans quelle mesure un professionnel de la santé qui arrive d'une autre province que le Nouveau-Brunswick, lorsqu'il fait son entrée, dans quelle mesure est-ce qu'il peut être exempté et à combien de reprises ça a été fait? Autrement dit, combien de travailleurs de la santé n'ont pas à faire la période de 14 jours d'isolement lorsqu'ils rentrent au Nouveau-Brunswick?
Il y a vraiment, pour quelqu'un qui demeure au Nouveau-Brunswick et sort de la province et retourne, un travailleur de santé, ils sont obligés d'isoler pendant 14 jours. S'il y a quelqu'un qui vient hors du province pour venir ici, tel qu'un travailleur de santé ou une autre sorte, il y a des arrangements avec WorkSafe NB où l'isolement peut être fait au travail. Mais vraiment, les gens qui sortent du Nouveau-Brunswick puis reviennent, ils devraient isoler pendant 14 jours, sauf que ceux qui vont et viennent chaque jour parce qu'ils demeurent sur un côté de la frontière puis ils travaillent ici au Nouveau-Brunswick. Alors, ceux-là peuvent aller et venir chaque jour sans la nécessité sans avoir besoin d'isoler pendant 14 jours. Ça, c'est quelque chose qui est fait partout dans la province où les gens travaillent, des travailleurs de santé demeurent sur l'autre côté de la frontière et va et vient chaque jour.
Merci, Madame Norman. Merci, Dr. Mike Cameron, CTV.
Thanks, Bruce. I'm not sure if this is a Dr. Russell question or perhaps both to Dr. Russell and Premier Higgs. I wonder, at what point would the government or the health department consider closing off a zone, perhaps Zone 5, to essential travel only, similar to perhaps the border restrictions we have at provincial borders? And how would that be enforced, or would that even ever be considered?
Well, right now, we are strongly recommended that people only travel for essential reasons. And again, the medical officers of health in the regions have expressed their concern about making sure that we get that message out to the public. But there are no plans to have public safety actually set up controls or measures or checkpoints or anything like that at this time. So, and again, this is an evolving situation. And what we are aware of is that we will definitely have contacts outside of Zone 5. So restricting the movement completely wouldn't really help when we know there are going to be cases outside of Zone 5. But for right now, we know that the majority of them would be in Zone 5. And so while we're doing the contact tracing and the testing over the next 5 to 7 days, it is really important to that people are encouraged to limit their movement. As I don't know if you listened to the actual speeches that the Premier and I did earlier, but I was likening the situation to when you're younger and you're at a birthday party and you play the game called the freeze dance. You know, if everybody froze right now, yes, that would be helpful and we could get this under control. But there are certain elements of society and the economy that we want to be very conscious of in terms of doing what's necessary with the risks that we have in front of us at this moment in time. So that would be ideal. But again, we're looking at this from a zone perspective, knowing that the rest of the province can be affected. But we know that the majority of the contacts and the testing needs to happen right now in Zone 5. But we are aware that there are probably some things that are going to happen outside of Zone 5 with respect to contact tracing and testing in the next 5 to 7 days. And again, the incubation period is 14 days, so again, we'll be watching very closely over the next 14 days what things emerge.
Thank you, Mr. Cameron. Thank you, Dr. Tom Bateman, Times and Transcript.
Yeah, good afternoon. I'm looking for more information on which facility this new case of COVID-19 in a healthcare worker was associated to. Can you just identify that facility, maybe the job the worker was doing, and whether that worker worked in one or more healthcare facilities? Thank you.
So at this moment in time, what I can tell you is that the healthcare worker in the long-term care facility, the work that has been done with the regional public health team was to identify where in the building they worked and who they had contact with. And as a result of all that information, they're testing the entire nursing home today. In fact, they're almost finished, and they are testing all the staff. And so in terms of the actions that we need to take as a result of that, there were about 50 residents in that facility, and again, we have a rapid deployment team that was sent there to test them all, and they're practically done. So in terms of the risks to residents and staff, all the residents have been isolated, and so that's the other part of the actions that have been taken thus far to protect people.
Thank you, Mr. Bateman. Thank you, Dr. Nicolas Steinbach, Radio Canada.
Merci, Bruce. La question s'adresse à M. Higgs et Dr. Russell. M. Trudeau, le Premier ministre Justin Trudeau, a annoncé tantôt au point de presse quotidien qu'il aimerait rendre plus flexible la fermeture de la frontière Canada-États-Unis pour permettre certaines réunifications familiales. Je voudrais savoir ce que vous en pensez.
So this was a discussion in our national meeting last night in relation to border opening for close family and friends. And I don't know to what extent at this point that public health have been conversing on this issue across the country. Dr. Russell can speak to that. But our concern and the concern I relayed to the Prime Minister was in relation to the protocol. I had mentioned earlier that Prime Minister Freeland had called me on this item just a few hours ago. So in fact, it's not, opening movement back and forth across the border. It's basically identifying close family or friends that would come and visit and stay through our quarantine period. So they would come for the 14 days, so they're visiting. But it's not just coming in for a day or two or an hour or two. And there would be more or less a registration or application process. So those details are yet to be worked out. But I think it's worth considering in that regard, because it is about how do we manage this and how do we get family and friends back together as we are in our province, but it has to be something done in conjunction with meeting our public health requirements.
Merci, Mr. Steinbeck. Merci, Monsieur Premier Ministre. Brianna James, Northern Light.
Thanks, Bruce. This is a question for the Premier. A post on the Village of Belgium Facebook page said it was confirmed by the regional EMO coordinator the village is exempt from return to orange phase and remains yellow. Is Belgium classified as Zone 5, and if so, why are they exempt, and have safety measures been put in place to isolate the community from the rest of the zone?
So the fact is they're not exempt. They will be under the same restrictions as Zone 5 or the Campbellton region. I think that message got out prematurely. At this point, we've said that it's not a matter of trying to find a line in the sand and just jump across and you're good. It is trying to contain this region in a way that we can understand the extent of the virus movement and how many people are impacted. And we haven't had the opportunity to do that yet. There's diligent efforts being exerted right now by public health in how they can determine just how widespread is it. And so at this point in time, as we said collectively, Dr. Russell and myself, in the original press releases, that we were looking at the Campbellton to Beldoon area and across the north. So that stays intact.
Thank you, Ms. James. Isabelle Larose, Radio-Canada.
Oui, ma question est pour Dr. Russell. Parmi les 150 personnes là, qui ont été potentiellement exposées au virus, comme vous l'avez annoncé hier, pouvez-vous me dire combien sont des résidents de la Gaspésie au Québec et de quelle façon vous collaborez avec la Direction de santé publique Gaspésie-Île-de-la-Madeleine?
J'ai pas les détails sur des contacts étroits à ce moment-ci, sauf que le processus que la santé publique dans les régions va suivre, c'est le même dans chaque éclosion, quel que soit. Alors, s'il y avait des contacts étroits hors de la province, notre équipe de santé publique ici au Nouveau-Brunswick communiquerait avec la santé publique en Québec directement.
Merci, Madame Larose. Kelly Grant, Globe and Mail. Simon Delacre, l'Acadie Nouvelle. Savannah Odd, Telegraph Journal.
Hi there. My question is for Dr. Russell. I'm wondering if you're able to confirm whether we know the extent of the contacts beyond that one home that has been tested, so whether this person maybe worked in other facilities. We're hearing they worked within the Manoir de la Vallée in Ottawa, and I'm wondering if you can confirm that as well. Thank you.
I don't have any information other than what I have given you already, but again, this is an ongoing situation and we get reports several times a day, so that could change in terms of what we have information to discuss with you tomorrow.
Thank you, Ms. Odd. Colin McPhail, CBC.
Thanks, Bruce. My question's for Dr. Russell. Does public health
have a handle on how many patients were transferred during the relevant period from the Campbellton Hospital to George Dumont in Moncton or other hospitals outside Zone 5 for more specialized care? And is there contact tracing following up with those patients and anyone in contact with them in those areas?
So there's two parts to that question. One would be the contact tracing, whereby we know that those patients may have had close contact with the diagnosed cases thus far. I don't have any specific information that other than to say we have the lists of all the patients that would have come into contact with the healthcare workers at this moment in time. But as a precaution, my understanding is that if they weren't on the list of close contacts, there's still, each hospital is aware of if there were any transfer patients from Campbellton, and they are taking droplet precautions at this moment in time, and making sure that they, from the date that they arrived to that 14-day period, making sure that they take those types of precautions while they're there.
Thank you, Mr. McPhail. Thank you, Doctor. Simon Delatte, l'Acadie Nouvelle. Voilà la fin de notre mise au jour. Merci beaucoup. That concludes today's update. Thank you.